Alright, let's talk dive injuries. So, quick recap. 1 atmosphere of pressure at sea level, or 760 millimeters of mercury. Pressure changes get a little more predictable as we go down, but also more severe. So, rule of thumb, for every 10 meters, or 33 feet below sea level, the atmospheric pressure increases by 1. So, 1 atmosphere at sea level, 2 atmosphere at 10 meters below, 3 at 20, and so on. These rapid changes in pressure mean that divers can go from really high to really low pressures really quickly, and this can cause a lot of issues. A quick review of the gas laws is probably needed here as well. So Boyle's law, the higher the pressure, the smaller the volume. This means that if we take a deep breath while we're at the surface, there's going to be very little volume of air left when we get at depth. More concerning is the reverse. If we're diving and we ascend too quickly, any air that's in our body is going to expand rapidly as the pressure decreases. This is what we call barotrauma, and it can go from mildly uncomfortable to really life-threatening. For example, if someone were to take a deep breath while diving and then rapidly ascend, the air in their lungs would expand, and they could develop POPS, pulmonary overpressurization syndrome, which can lead to ARDS and alveolar damage, or a full-tension pneumothorax. Boyle's law isn't the only law we need to remember here. Dalton's law, the total pressure of gas is made up by the sum of its parts. Well, at 1 atmosphere, the air we breathe in is 593 millimeters of mercury of nitrogen. Normally, that's not enough nitrogen to get into the bloodstream and have any effect. But at depth, say at 10 meters, when that pressure increases to 2 atmospheres, the pressure of nitrogen doubles, and that can start to have some anesthetic effects. It's the same effects that laughing gas, or nitrous oxide, have on the body. So disorientation, euphoria, impaired cognitive performance. It's actually a really serious condition called nitrogen narcosis. And there's loads of cases of divers just taking off their respirators and swimming off into the sunset, never to be seen again. To help prevent this, diving tanks are commonly filled with lower concentrations of nitrogen, and they add helium, called heliox or trimix. Treatment for nitrogen narcosis is a controlled ascent to the surface, with patients usually completely recovered or back to normal before they even get to the top. If they are still altered, other diseases should be considered. The last diving disease we need to talk about is decompression sickness. So this occurs when air bubbles form inside the bloodstream, caused by increased pressure above the alveoli, which is Henry's law. While you're at depth, you'd never know that you had any air bubbles in there. They just float around harmlessly and get absorbed into tissues. The problem occurs when people ascend too rapidly. Those air bubbles, usually made up of nitrogen, will expand as the pressure drops and start to cause complications depending on where they land. Air bubbles forming in joints, skin, and lymphatic tissues typically cause pain, localized swelling, and discomfort, and they'd be categorized as a type 1 decompression sickness, or the BENS. And when more important organs like the heart, lungs, and brain are affected, this can cause type 2 decompression sickness, or an arterial gas embolism. Stroke-like symptoms, seizures, severe dyspnea, and cardiovascular issues can be caused and will typically start presenting during or shortly after the ascent. There's a bunch of risk factors for developing decompression sickness, but the most common one is a rapid ascent. Treatment is pretty straightforward. Besides symptom management, give them high-flow O2 and get them to a hyperbaric chamber. They'll use this chamber to recreate the pressure at depth and then lower it slowly as the patient improves.